Hi everyone, my name is Madison and I'm doing my presentation on diabetic management and prevention in India. So the problem and geographical area. So this presentation is based mostly on type 2 diabetes mellitus and specifically in India. Diabetes mellitus is a significant global public health concern, but India has one of the world's largest populations living with diabetes. Both type 1 and type 2 diabetes contribute to increasing morbidity and mortality rates, and especially in those in the rural and low-income populations. They unfortunately face limited healthcare access and resources and delayed diagnoses as well. The growing burden places significant pressure on India's healthcare system and population. For a historical perspective, diabetes prevalence has increased over the past several decades, causing rapid urbanization, changing lifestyles, and dietary changes has specifically contributed to the rising cases, especially in India. And diabetes affects all socioeconomic groups, wealthy, poor. It can affect anyone who is not able to and has limited access to being able to control and manage. Increased life expectancy and aging populations have also contributed to disease burden as well. The WHO has identified diabetes as one of the fastest growing non-communicable diseases worldwide. So for diabetes in India, India has one of the highest numbers of adults living with diabetes. However, that number does not necessarily include undiagnosed individuals who live with diabetes on the daily. You'll mostly see that in rural communities or those with low-income communities as well. Major risk factors include obesity, sedentary lifestyles or physical inactivity, poor nutrition and poor dieting and food choices, family history, and limited health education and literacy as well. Uncontrolled diabetes increases the risk for cardiovascular disease, such as hypertension or hyperlipidemia. Can cause kidney disease and can result in kidney failure. Neuropathy, which is basically just nerve damage, especially in those lower extremities for our diabetics. Vision loss, such as blindness, and premature death as well. The impact on society. Social impact, reduced quality of life, increased disability due to these morbidities and diseases, family caregiving burden, especially in those who unfortunately can't take care of themselves. Families have to kind of step in and help them, and health disparities among rural populations as well. Economic impact, high healthcare costs, especially those unaffordable medications and healthcare visits as well. Lost productivity, increased hospitalizations. This can be due because individuals in these rural populations or in these communities with low income wait till the last minute, wait till they can't no more, and that increases their need for hospitalization and increases their stay because their disease is so progressed that it needs extra care and treatment. Long-term costs from diabetes complications, like I said before, which also causes hospitalization, and financial hardship for low-income families as well. So what are some solution and treatment options to improve diabetes management? So increasing access to primary healthcare services and resources, expanding screening programs, improving medication availability and affordability as well, promoting routine follow-up appointments, making sure that we are controlling the disease, expanding telehealth services or mobile health clinics in rural communities, and importantly, also training healthcare providers or nurses or any healthcare professional in diabetes education and management, and really addressing patients' concerns and understandings on diabetes. So prevention plan that I've created is a 5-year prevention plan. Year 1, community assessments, screenings, public awareness campaigns or flyers. Year 2 and 3, nutrition education, promoting eating a well-balanced diet, school-based health programs, which can also include diets in the cafeteria, routine community screenings, and physical activity promotion, staying active, avoiding drinking and smoking, reducing stress levels, seeing doctors for regular checkups, and maintaining a healthy weight and decreasing obesity will also help prevent and manage diabetes. And then years 4 and 5, improving healthcare access and resources, telehealth and mobile health care, clinic expansions, long-term diabetes management, and overall evaluating the program outcomes and results, and continuing our research throughout the years to come based on community needs. For cultural aspects, we need to address cultural factors such as respect traditional dietary practices while also promoting healthier alternatives, especially those who have specific cultural practices in terms of nutrition. Providing education in local languages, such as with healthcare providers using interpreters, working with community leaders to increase trust, improving health literacy through cultural appropriate materials. So based on their language, you can do it written or verbal or videos. It is recommended to teach patients at a 5th or 6th grade reading material or teaching to really help better their understanding, especially in diseases that require much more extensive and long-term care. Addressing economic barriers to healthy foods and medications, and encouraging family participation in diabetes management, especially in those who have little ones with diabetes as well. The WHO involvement, which is the World Health Organization, promotes early diagnosis and screenings, supports diabetic policies nationally, develops evidence-based treatment guidelines, improves access to essential medicines, encourages healthy diets and physical activity, which is all to help prevent and promote management, monitors global diabetic trends through Global Health Observatory, and overall WHO emphasizes reducing diseases through prevention and access to services and resources. And then just a couple references specifically through the World Health Organization. Thank you.